Myelofibrosis is a disease where patients are afflicted by splenomegaly, symptoms, the potential of anemia, and sadly, risk of premature death. We currently have 3 FDA-approved therapies, ruxolitinib, fedratinib, and pacritinib, that improve splenomegaly and symptoms. Pacritinib also safe for patients with a low platelet count, but we truly don't have an agent yet that helps improve all aspects of the disease, including anemia. Momelotinib is a JAK1, JAK2 inhibitor that also inhibits ACVR1 that decreases hepcidin that we have found helps to improve anemia. So it's a drug in earlier trials, Simplify 1 and Simplify 2, that it can improve splenomegaly symptoms and anemia. The Momentum study was a phase 3 study to specifically outline its benefit for individuals in the second-line setting. So 195 patients were randomized between momelotinib and danazol, an androgen active as best alternative therapy for anemia, randomized in a 2-to-1 fashion with endpoints of trying to improve symptoms, splenomegaly, and anemia in individuals that previously had failed JAK inhibition. We found in this study that momelotinib was very effective as second-line therapy for this group of individuals, and it met all of its endpoints. So what did that mean? First, it was clearly superior to danazol for improvement in symptoms. That was the primary goal of the study, and it was rewarding to see that. Secondly, it was non-inferior for danazol as related to improvement in anemia. We knew going in that danazol was active for anemia. We saw really a trend for superiority, so 13 to 31% transfusion independence for momelotinib versus just 15 to 20% with danazol. Didn't quite reach the threshold of statistical significance for superiority, but the trial really was aimed as a non-inferiority study. We did notice that if we looked at just individuals that were transfusion independent or became transfusion independent with 0 transfusions, momelotinib was clearly superior to danazol. Third, and importantly, there was clear superiority of improvement in splenomegaly, a difficult feature of myelofibrosis. Whether we looked at 2 different thresholds, a 35% volume reduction or a 25% volume reduction, probably more realistic for individuals in the second-line setting, a full 40% of patients had that response. So our takeaways is that the drug was very active and clearly was superior to the best alternative therapy for improving splenomegaly, symptoms, and anemia. I think that first, the therapy will need to be approved, which will be a critical step. But I think if it is approved, it clearly will have a significant role in the therapy of myelofibrosis. It remains a heterogeneous disease, but in individuals in the frontline setting that have significant anemia, I suspect momelotinib will be a very important consideration. As with all of these things, there's kind of individualized considerations in terms of choice of therapy. We're working on the correlatives as well to best understand are there specific molecular subgroups or other markers that help best predict response. But I think it will be a strong consideration for frontline for patients with anemia. Second, as second-line therapy, very much aligned with the data that we have here from the Momentum study, I think it really makes a very strong case for patients with anemia to be considered for therapy with momelotinib. So I think it definitely will make an important impact on really fleshing out the options that patients with myelofibrosis will have for care of their disease.